I want to talk to you a little bit about back pain and the correlation with C-section scar. If you know my history, I had a C-section many years ago and had a lot of contributing back pain as a result of that scar tissue. I wanted to kind of talk about why I see that as a common thing when people come into my practice. And it doesn't have to be a C-section scar. It could be abdominal surgery. It could be from sitting for long periods of time where their psoas muscle just gets really shortened down and tightened, and that's a big contributor to a lot of back pain. So I treat a lot of back issues through the belly. The bikini cut is like a little smiley face on the lower end of the pelvis here. Well, a vertical cut causes issues that could be higher up as well as low, and the bikini cut affects the whole pelvic bowl. But we see more often that they are this bikini cut to kind of hide that big scar in the abdomen. What can happen is everything in this pelvic bowl basically is impacted. I have a little step off here in my spine where this disc and this vertebrae actually are pulled forward. They're pulled forward and it actually pinches that disc periodically. It can cause a whole host of issues, and it has caused a whole host of issues for me. But what happens is that bone actually starts to break down a little bit because it's not fully supported. It's pulled off its center, and the disc could be pinching a bit. So that's one of the things that can be happening with back pain is maybe they're pulling forward too much, and that's contributing to their symptoms. Here would be your normal spine. So there's a slight curve, soft belly, and that all looks good. When your psoas muscle gets tight and you have scar tissue that can pull you forward, this is what can happen. A bigger arch in the back, their belly pops out, and it actually causes some pinching in the low back. And so I teach patients how to stretch both in the front and in the back. Today I'm actually going to show you a quick little psoas stretch. So I have a ball here, and what I'm going to do is, because I'm specifically focusing on a C-section scar. It's low here. I have this lovely bikini cut scar. When you treat your psoas, you can actually treat this whole area here, and it's on both sides with the, with your scar tissue. You want to treat around the area of the scar itself and where you actually feel it the most. So what I'm going to do is I'm going to actually lay on the table here. I'm going to put this ball into my belly, and I'm just going to let it sink and relax. If I'm not feeling anything, guess what? I'm probably not doing anything. If you feel something, it's probably a good place to be. You might want to, play around with it a little bit. Where do you feel it more? You feel a little bit more on this side? Typically, you're going to have more sensations in one part of the body or another. So what you're going to want to do, I'm just going to put this ball into my abdomen, and I'm going to sink in, and I'm going to relax. Now, I typically do this on the floor. For the video camera, I'm just doing it on the table. But typically I do it on the floor because I can feel it more. I actually don't feel a whole lot in my belly right now because the cushion of this table is actually taking out the pressure in my abdomen. That's one of the ways that you can work on treating that scar tissue that then affects your belly as well.